Today, we'll be talking about the glaucoma and the ocular surface. Ocular surface disease can cause problems in glaucoma because of reduced visual function and quality of life. It can also cause increased healthcare costs and a burden in the society. There is problems of compliance to glaucoma eye drops in patients with ocular surface disease, and because of the ocular surface disease, the treatment may require steroids, which will then cause an issue in the control of the glaucoma. Fibrosis may also reduce surgical success. Certain symptoms of ocular surface are very common in patients with glaucoma. For example, foreign body sensation, itchiness, photophobia, redness, and on clinical examination, often we find increased fluorescein staining, reduced tear breakup times, and reduced visual acuity. At the same time, there could be follicular hyperplasia, meibomian gland dysfunction, and conjunctival chalasis. In a series of dry eye patients that presents to Singapore National Eye Centre, we found that the patients with glaucoma eye drops or glaucoma surgery presents with the higher level of dry eye symptoms. In another series, we found that the patients with medications for glaucoma or have been operated on for glaucoma have a higher risk of increased tear film osmolarity or increased dry eye symptoms. The question is, if you have been diagnosed with glaucoma, what proportion of the patients will develop ocular surface disease? To answer this question, we look at a cohort of glaucoma patients that have been freshly diagnosed. This includes about 500 patients over a few years, and they have been treated on not only monotherapy but sometimes a combination of glaucoma eye drops. And interestingly, over a period of 5 years, as high as 60% of the patients have been started on lubricating eye drops for dry eye. And this is higher than a comparative group of patients with diabetes who didn't have glaucoma. What happens to the tear in patients with glaucoma eye drops? We found in a study using proteomics that there were several proteins that were upregulated in patients with glaucoma medications. Here, this slide shows you that this protein that is called 14-3-3 has increased levels in patients with glaucoma compared to controls. And the correlation analysis shows that there is an effect of the duration of glaucoma treatment and the protein levels, especially for the S100A8 protein. There is a higher level in the tears in patients that's been treated with a longer duration of anti-glaucoma eye drops. These are some of the examples of the glaucoma eye drops that's been used in that study. Why do we get increased problems with the glaucoma eye drops? Firstly, this could be an effect of the preservatives, especially benzalkonium chloride. It can also be due to non-preservative effects. For example, the active ingredient itself may cause ocular surface disease. We conduct a series of cell culture experiments to look at the potential mechanisms for ocular surface disease in glaucoma patients. So, as you can see on the right-hand side, there's a series of different commercially available glaucoma eye drops, and over a short period of time of as short as 15 minutes, we find that there's a reduction in cell viability of many of these cells that's been treated to these commercial eye drops. This is just to show you that with increased concentration of benzalkonium chloride, there is also reduced cell viability even without using any of these commercial drops. We also perform some studies on apoptosis and necrosis, and we find that depending on which eye drop, there could be a combination of apoptosis as well as necrosis in the cultured cells when exposed to these commercially available glaucoma drops. Stoltosporin at the bottom and caspase inhibitors are just positive controls. Reactive oxygen species or oxidative stress showed that many of these glaucoma drops induce significant amounts of oxidative stress as well. And here you can see the effects of the positive control, which is the hydrogen peroxide in the bottom graphs. What about the effect on cytokine production? We find that many of these commercial drops, including Lumigan, Travatan, especially Travatan, also increase the level of cytokines. On the left, we show that Lumigan 0.03% increased the level of interleukin 6 in the tears, and on the right, Travatan causes increase in interleukin 8 in the tears. What are some of the mechanisms of ocular surface disease? This could be a form of allergic keratoconjunctivitis, but it can also be various processes leading to inflammation. For example, the loss of barrier function in the cornea, the loss of goblet cells, and increased antigen-presenting Langerhans cells. At the same time, in severe cases, there could be limbal stem cell deficiency as well. Meibomian gland dysfunction is defined as a chronic diffuse abnormality of meibomian glands, characterized by terminal duct obstruction and leading to changes in the meibum quality or the quantity. Here, you can see that the obstruction of the meibomian gland is a central process in MGD, and at the same time, there could be increased bacterial growth and other factors. The principle of eyelid warming includes trying to provide a temperature that melts the meibum so that there would not be excessive obstruction of the meibomian glands. Trabeculectomy could affect dry eye and ocular surface in several ways. This could be via the effect of mitomycin C eye drops during the surgery or aminoglycoside eye drops after the surgery. Because of the glaucoma trabeculectomy bleb, there could be an effect on tear spreading, and also some patients might have reduced eyelid hygiene measures after the surgery. Some patients have undiagnosed preoperative dry eye, which can contribute to worsening of the ocular surface after the surgery. In this series of patients, we showed some ocular surface disease in patients that had undergone trabeculectomy. The question is, what happens to the patients in the long term after glaucoma surgery? When we perform conjunctival impression cytologies followed by the analysis of inflammatory genes, we found that a series of at least 6 inflammatory genes were downregulated at the 3-year point after the glaucoma surgery. This suggests that glaucoma surgery is beneficial in the long term in the reduction of ocular surface inflammation. In conclusion, ocular surface disease is very common in glaucoma patients. The presence of dry eye can affect compliance to glaucoma treatment. At the same time, treatment for the dry eye may affect glaucoma control. Assessment of ocular surface disease needs to incorporate the aggravating factors, and the use of non-preserved glaucoma eye drops is important to minimize ocular surface disease. Thirdly, treatment of ocular surface disease is an important component in patients with glaucoma. When it comes to the treatment of ocular surface disease, one has to remember that it's easier to treat patients that had undergone trabeculectomy. Secondly, there are now many in-office treatment procedures for MGD that's available.